When I'm teaching residents and medical students, I like to play a little game. I'll say the name of one medicine, and you tell me the very first thing that comes to mind. N-acetylcysteine. Yep, most of us think it, Tylenol overdose, and that's exactly right. That's what we were taught, that's what we use it for in the emergency room. For decades, NAC has been one of the most dramatic medicines in the emergency department. You can give it early after an acetaminophen overdose and literally prevent liver failure. But here's the fascinating part. What if I told you the same medicine we trusted in the ED for over 40 years also can influence glutamate signaling, oxidative stress and damage, compulsive behaviors, addiction, anxiety, obsessive thinking, compulsion, even smoking cravings? Today I want to walk through what we know about and how I use NAC. I'm Dr. Arwen Podesta. I'm a psychiatrist. On this channel, we break down mental health, neuroscience, and integrative strategies in a way that's practical and evidence-based, whether you're a clinician or someone just trying to understand your own mental health. I think and talk a lot about micronutrients, about vitamins, botanicals, because they really are part of an integrative solution for mental health needs. Whether someone wanting whole wellness, someone not wanting medicine, someone wanting to augment their medication to thrive, someone maybe in early addiction recovery, anyone with brain needs like depression, anxiety, etc. All of these things, the micronutrients, vitamins, botanicals, they're part of pathways and building blocks that are necessary for cellular health. Okay, so NAC works in acetaminophen toxicity, but why? Well, it replenishes glutathione, which is the body's master intracellular antioxidant. In an acetaminophen overdose, toxic metabolites rapidly deplete the glutathione, allowing liver injury to occur. But if we administer NAC early enough, you restore your glutathione before irreversible damage develops. It's a great example in medicine of understanding a biochemical pathway and then using that to our advantage, using it therapeutically. Interesting though, glutathione isn't only important in the liver. The rest of the body uses it too. The brain relies heavily on its antioxidant defenses. So here I am, a psychiatrist, not an emergency doctor, and psychiatry started paying attention because the brain balance isn't simply about dopamine or serotonin. One of the biggest discoveries over the past couple of decades is that mental health and addiction fundamentally changes and is changed by glutamate signaling, especially in and around the nucleus accumbens, part of the reward pathway. So if somebody develops mental health issues, substance use disorders, glutamate homeostasis is disrupted. And that contributes to things like cravings, compulsions, relapse in substance use, impaired executive functioning, and psychiatric symptoms too. And NAC helps normalize extracellular glutamate through activation of this antiporter. Don't think you need to know the name, but it's cysteine glutamate antiporter. So rather than creating a reward, it actually reduces the brain's tendency to overreact to triggers. And that's a totally different mechanism than most psychiatric medications. All right, so let's talk data. The evidence is promising, but as usual, especially for supplements that aren't being studied by deep-pocketed pharma companies for FDA approval, the evidence is nuanced. And there's lots of randomized controlled trials and earlier meta-analyses that did show reduced cravings, that did show some improvement in different mental health needs. However, a newer meta-analysis published in 2024 found much more mixed results, noting heterogeneity among studies and concluding that while NAC remains promising, the evidence is not definitive. And that's how I like to present it to patients. We're not here to use NAC for everybody and not use NAC instead of evidence-based meds. It's just another important tool that can reduce symptoms, that can improve resilience, especially when used alongside evidence-based treatments. NAC isn't only being studied for addiction. There's growing literature and information evaluating NAC for generalized anxiety, for obsessive-compulsive disorder, trichotillomania, picking disorders, and major depressive disorder and bipolar depression. And why is that? Well, the common thread of these illnesses involve oxidative stress, neuroinflammation, and dysregulated glutamate transmission. While results vary by diagnosis and by individual, NHC has a very good safety profile and can easily serve as an adjunct for standard psychiatric treatment in these realms. So what do we do? How do I use this? Well, typical dose ranges are 600 milligrams to 2400 milligrams daily in divided doses. And usually I'll start with a starting dose of 600 or 900. The capsules usually come in 600 to 900. There's also a scoop, a powder. And that's kind of the lower dose is kind of more for antioxidant support, or patients may be sensitive to supplements. But we usually then will bump it up to twice a day. And then for those with significant psychiatric needs and addiction, the most studied doses are 1200 milligrams twice daily, totaling 2400 daily. And that would be for like pretty severe anxiety, for smoking cessation. That's what was studied. And most studies continue to treat for 8 to 12 weeks. And that's when we see benefits. And the benefits are actually gradual. They're not immediate. So they don't suddenly come on and the patient feels better immediately. So we really have to let it wait out. So here's some take-home points. I want to leave you with 3 thoughts. First of all, don't think of NAC as simply a Tylenol overdose drug only. Second, NAC really is one of the more biologically interesting adjuncts in addiction and psychiatry. And finally, its real promise lies in restoring healthy glutamate signaling and reducing oxidative damage and stress. So think about adding NAC for cravings, for anxiety, for mood, whatever could benefit from oxidative stress amelioration and glutamate balancing. But it's not in a bubble. We want to consider NAC alongside other treatments. You know, as physicians, we spend so much of our time trying to help the brain recover from injury, whether that injury comes from trauma, from inflammation, psychiatric illness, or addiction, whatever. But NAC reminds us that recovery isn't always about creating a new pathway. Sometimes it's simply restoring the one that was there all along. Thank you for watching.